We all know that things change as you age. A large number of people, men and women, are turning to testosterone pellets to deal with it. For men, it can treat issues related to low T. For women, it can help with low libido.
9 News medical expert Dr. Paul Coley is with us to talk about that issue. And for viewers who have not heard about these testosterone pellets, full disclosure, I was watching an episode of The Real Housewives of Orange County. Okay. And a couple of the housewives went as like a group activity, and they got the little pellets in their booty, and they say it helps with libido and energy. And
I need the energy and the libido, I'll be honest.
It got me thinking.
Okay.
Dr. Coley,
Yes.
Does this work?
It totally works, but whether you should take it or not is another question. So these are little tiny, picture a grain of rice, and they put a little pellet in your buttocks, like you said, or in
one or multiple?
Usually one.
Okay.
And it's a timed release testosterone over time that releases over several months. Now, why did the housewives get it?
Energy, libido, mainly those two factors.
And are the housewives premenopausal or postmenopausal?
That's a really good question. I'm not sure. I want to say around our age. I think they're in their 40s, like lower to mid 40s.
Yeah. So this is the first question to ask, because what they're indicated for loosely is postmenopausal women, because when we think about our ovaries, they actually make testosterone, and so do our adrenal glands. So young women have testosterone. When we go into menopause, the ovaries shut off the testosterone. It still comes from the adrenals, but our testosterone levels can go down as women. So the only thing that the guideline societies recommend, potentially testosterone and not pellets, we'll talk about other types in a second, is for low libido, because it could potentially help postmenopausal women. Now, they've experimented for energy, for bone density, for mood, for all these other things, but the studies are really inconclusive there. And in fact, in some people, it can actually make you angry, irritable, and all the other things that testosterone does. So they recommend against pellets. They say instead you should think about creams or patches if you are gonna think about replacing testosterone as a woman, because those are titratable. You can imagine a grain of rice in your booty. Once you put it in there and it dissolves, it's really hard to take it out, so it's not really reversible.
Gotcha. So would the patches and the creams be as effective of the grain of rice pellet?
Yes, they're just as effective, but you have to deal with them every day. Now, I'm not endorsing this. Honestly, I don't think it's a great idea for premenopausal women, because there are a lot of risks associated with it. So if you think about what testosterone does to a woman, it causes acne, it can deepen your voice, and that can actually be irreversible, especially if you have a pellet, which can lead to high doses of the medication. It can cause enlargement of the clitoris, which can also be irreversible. It can cause increased cancer risk, heart disease risk, increased blood clot risk. So I'm not a huge fan of putting something in there that you can't take out, especially when it has all these risks associated with it.
But a little patch, what if I'm like, oh, I'm gonna just try this out and see how it works? Yeah.
Okay, so, hey, Ryan.
Samantha. But in theory, if one wanted to try one of those things, could you decide maybe this isn't for me and it wouldn't have some of this like harm long-term effects?
So if you are a premenopausal woman who wants to try this, I would say do these following things. Talk to your doctor about checking your testosterone level, because if your testosterone level is low, then certainly it's indicated. And then when you replete it with the patch or the cream, not with the pellet, because those are compounded and not as safe, then you actually then follow up with the testosterone blood test a few weeks later to make sure you're in the right range. And if you do that, you can potentially increase, obviously, the benefits, which is sex drive, potentially a little bit of energy, without necessarily having all the risks associated with it.
And you mentioned the limitations of science. Do you see that changing? I mean, I feel like anything that has to do, I know that men can take the testosterone pellets too, but you know, with women, whether it's menopause, perimenopause, there just seems like that there's a lack of scientific evidence, because there's not as much, are women just not as much as a priority when the medical industry does its studies?
It's partly because they keep women out of trials because of menopause and risk of pregnancy. So they actually sometimes exclude women. In general, women are underrepresented in trials, but for this particular thing, testosterone is only FDA approved for men, the supplements. And so these are being used in an off-label fashion for women, which has been one of the challenges of the study. The other thing is it's all observational and recall. So it could be placebo effect. Let's say I actually just put a grain of rice in your buttocks rather than an actual testosterone pellet, but you think it's making you feel more energetic or improving your sex drive. That's called placebo effect. So the best way to study this would be a randomized trial where you pretend to put something in someone and don't put anything versus putting something and seeing if there's a difference. But those are harder to do because we don't have a lot of women who sign up for studies where they're randomized to one thing or the other. So the science is very limited here. It's very, very conflicting. And so if we want to proceed with thinking about giving ourselves a little testosterone, we have to be sure we do it very carefully under medical supervision, not with a naturopath or anything else, and definitely dead set against those pellets because they're not removable, they're not titratable.
But if this is something, after even hearing all of that, your medical advice is go talk to your doctor.
Go talk to your doctor, check your level, and then think about whether it makes sense to replete it. Because for women who suffer from this hypoactive sexual desire disorder, which is low sex drive, this can be game-changing. And I feel like when it comes to sexual symptoms in women, we often don't take them seriously enough. We often don't treat them aggressively enough. So if this is something that's really getting in the way of your life, go talk to your doctor and see if it makes sense.
Yeah, and you wouldn't know if those levels aren't where they're supposed to be unless someone, like
Checks
a
it.
doctor, tells you.
That's exactly right.
Who knows? It could be something else.
Okay.
Yeah.
Dr. Coley, thank you.